Number one, when you're sick, somebody else at work has to take on their work burden and yours. And when we do that, it's usually the patient that suffers because we can't deliver the same care.
My name is Debra Wilkerson, and I've been a nursing assistant since I was 16 years old. I always wanted to work with the elderly folks. It's important that I get the flu shot every year, to prevent myself from getting sick or staying home and not being on a job, to be able to help my co-workers. It will not only help me, but it will help others, those who work around me every day. Because me being home sick is not helping them at all. We need to be here together. When people out sick, they bring a lot of work on us. It affects the residents as well, because a lot of things that they want to be done might not be able to get everything done at that time because of us being short or not having enough help.
Because we know that half of healthcare workers every year get infected with influenza, and half of them are asymptomatic, you can't depend on the fact that, well, I'll know if I get influenza and I won't come to work. And then we come in and we take care of these patients. And the very reason we're taking care of them is they're sick, they're ill, they're immunocompromised, they're frail, they're elderly, they have asthma, they have heart disease, lung disease, diabetes. It doesn't matter what it is. And we transmit that infection to them.
My name is Sonam Patil. I'm a dietitian. I've been a dietitian for about 25 years, and I've been here at Longview Nursing Home for about 11 years. I get the flu shot every year because as a dietitian I work with elderly patients on a regular basis, and if I get sick, I put them at risk for the complications from the flu. My job is to nurture them and nourish them and to make them stronger and maintain their health. That's why I think it's very important for me to get the flu shot every year to prevent spreading the sickness to the fellow workers or the patients who I work with.
I'm Heather Price, and I've been working as a nursing assistant for almost 2 years at Longview. I get the flu shot because I want to protect my residents that I take care of. My residents are at a higher risk due to their age and that they are in such close quarters with several other people at all times. If a resident gets the flu, they could have high fevers, they could have developed pneumonia, their immune system is down, so they can have really any kind of infection that causes them to be ill. They need a little extra protection to keep them from becoming ill. If they get sick, they could become so ill they might have to be sent to the hospital, or they may even die. I'm here to protect my residents from injury and illness. That is what I'm here for.
The other thing is sometimes there's not a perfect match between what's in the vaccine and what's circulating. Nonetheless, there's some level of protection afforded. So you could get, let's say in a bad year where the vaccine does have some differences from what's circulating, it's possible you could get infected with the influenza virus and have a mild case of influenza, but you're not going to get pneumonia, you're not going to be hospitalized, and you're not going to die. And that's what the flu vaccine is built upon, preventing complications and death. It's a secondary benefit, not the primary benefit, that you don't have symptoms.